girl gang, it's Dr. Joy here and you are watching Delivering Joy MD TV. So today I really want to talk about the COVID-19 vaccine in pregnant and lactating women. So if you're pregnant or breastfeeding, stay tuned because this is going to give you some tips on how to make the decision as to whether or not you want to be vaccinated against COVID-19. Keep watching. All right, girl gang, so let's break this down. So in my video that I'm listing here in the cards, I actually break down the science behind the COVID-19 vaccine and talk a little bit about why I'm choosing to get the vaccine and why I think this vaccine is safe. So make sure you check that out. Today I want to deal especially with pregnancy and breastfeeding. And so the American College of OBGYNs, or ACOG, has recommended that this vaccine be given to pregnant or breastfeeding women, and that women should make this decision for themselves. Now, we have to keep in mind that the clinical trials for both the Pfizer and the Moderna vaccine have not included pregnant women. There were some women who became pregnant during the study, but pregnant women were not a part of the included population that we were studying. So we don't actually have any data yet on pregnant and breastfeeding women. These clinical trials are happening now, but we have not actually collected the data for these trials. So that is why most pregnant and breastfeeding women are left in a pretty interesting position, because you're being asked to make a decision about something we don't yet have great data for. So I'm hoping that today I can give you a few tips on how to navigate that decision-making process. So first, you want to consider what the infection rates are where you live. And you also want to think about what kind of work you're doing, if you're working outside of your home. If you are an essential worker, if you work in a grocery store, an assembly line, if you are a teacher, if you work in the healthcare field, these are higher risk for exposure to COVID-19. And so you may want to consider receiving the vaccine even prior to the end of the clinical trials that are being done now for pregnant or breastfeeding women. If you live at home with an essential worker who maybe works in healthcare, or who drives a delivery truck, or who is working with the public and has high rates of COVID-19 exposure, you may also want to consider being vaccinated before we have all of the data from the clinical trials. If you live in a multi-generational household, you might want to consider being vaccinated. And by multi-generational, I just mean you may have children in the household, adults in the household, elderly folks in the household. These are households that may be at higher risk for COVID exposure and for COVID disease. If you are a pregnant woman who has higher risk with COVID-19 infection, say you have diabetes, hypertension, asthma, history of other heart or lung diseases, you may want to consider taking the vaccine as well. We know that several weeks ago, the CDC did elevate pregnancy to be a high-risk category for COVID-19. That means that when pregnant women are actually symptomatic with COVID-19, they have a higher risk for being admitted to the intensive care unit, or ICU, and for needing pretty intensive hospital therapy. So if you already have an underlying chronic disease condition, consider getting vaccinated against COVID-19. Now, if you are relatively lower risk, let's say there are not a high number of infections in your area, you don't work outside of your home, you are able to stay home and to stay safe. If you don't live with essential workers who are out with the public every day, coming in contact with other folks and having close encounters with other people, if you don't feel comfortable or safe with the vaccine, these are all things that make it reasonable for you to delay vaccination until there are more clinical studies available and until we have that data. We think that based on the previous studies in non-pregnant women and in those women who became pregnant or were found to be pregnant during the clinical trials that we've done so far, that all of these women have done well. They will be continued to be followed until they actually deliver their babies, and then their babies will be followed as well. But we think that this is going to be a very safe and effective vaccination for the pregnant and breastfeeding population. Now, I'm going to link this card up here again because I want you really to check out the science behind this vaccine and to understand that we are not injecting any particle of the virus, any killed virus, anything that is viral at all. We're actually injecting a messenger that tells your cells to make a particular protein that this virus produces so that you can become immune to that protein. That protein is called the spike protein. And the spike protein is the protein that helps the COVID-19 virus attach to our cells and infect us. So you would actually be receiving a messenger that helps your own cells make this spike protein, and you would not have any of the other proteins or viral particles from COVID-19. If you have already delivered and you're breastfeeding, I am all for going right ahead and getting the COVID-19 vaccine. We know that as you start to produce immunity to that spike protein, you can pass that immunity to your baby, which conveys safety not only for you, but for your baby. So I think breastfeeding women should certainly feel very confident getting this vaccine. For pregnant women, you can choose whether you think this is right for you and your own personal health and that of your family. So I hope that these tips are a little helpful while we're awaiting data from the current clinical trials that are underway for pregnant and breastfeeding women. And if you have any questions, go ahead and post those down in the comments. I'll be happy to answer those. And make sure you subscribe so you don't miss a single episode. I'll be bringing you new data as we learn more about this vaccine in pregnancy and breastfeeding. I'll catch you next time, Girl Gang. Peace.